In every industry, everyone is just working so hard to acquire a new client. How do we get the next client and how do we get the next client? Instead of treating their current patients with, the proper approach on how to retain them with bonuses and gift cards and thank you notes. You've got someone so loyal to your brand, why are you trying to already get to the next?
What you really need is someone that's paying close attention to the lab works, medications, medication interactions, past medical history, and actually following the patient closely and giving them a customized treatment.
With all these treatments bouncing between state lines, how do you feel about registered nurses injecting Botox? How do you get experience? Like if you're a provider wanting to come to the industry, what is the best way to get experience?
What you really need is a physician mentor, someone that's been doing this for years and years, has practiced on thousands of patients, and can show you the idiosyncrasies of how to inject. Another medical spa files for bankruptcy in the state of Florida. I'm Dr. Christopher Singer, owner, practicing physician, and medical director of Excess Med Spa.
I'm Jay Feinberg, CEO of Refresh, and today we're going to be diving into, all the ins and outs of the aesthetic and wellness industry from a provider perspective and a patient perspective.
And right now in the state of Florida, we're reaching an interesting dynamic where a lot of medical spas are finding it harder to compete. They're going under. A lot of filing for Chapter 11 bankruptcy. Why do you think that is?
What's weird is Couture. Right? Couture Med Spa, one of the biggest in the industry, just closed 26 locations. And you'd think after the first couple, they would start to get it under their belt and have the proper administrative staff in place. But I think it strictly comes down to treating your employees right, having the proper providers in place so that you can establish client retention and patient retention, because in every industry, everyone is just working so hard to acquire a new client, right? How do we get the next client and how do we get the next client? Instead of treating their current patients with, the proper approach on how to retain them with, bonuses and gift cards and thank you notes. And, you've got someone so loyal to your brand, why are you trying to already get to the next? What's your take?
Well, I think Florida's always been probably one of the highest concentration of medical spas in the country, and it's getting more and more competitive. And with that, there's kind of a race to the bottom on price per service instead of a quality focusing standpoint. So if you're a business that's focused only on price and financial incentives and not the quality of experience for the patient, I think you're going to run into that problem eventually, especially as it heats up in the terms of how much competition there is.
That's crazy, because I feel like patients and practices are starting to treat Botox like it's a haircut, right? It doesn't require as much medical insight and knowledge of the procedure, which is really devaluing the overall treatment.
I mean, I would say they're treating it more like it's a product, because I have people come to me and they'll be like, "Oh, I went to Joe Schmo down the street, has no clue what they're doing, brand new injector, you're basically learning on me." And they charged me $8 per unit for Botox. I'm like, but it's a service. I mean, you're paying for the service, not the product. I mean, there's obviously a cost to dispensing the product, but what you're really paying for is a service. And it's apples and oranges. It's not all the same. Like, obviously, one medical spa will have an injector maybe that's much more experienced, has a lot of training, has a strong background in medical aesthetics, and another may just have someone that just got out of PA school and they took a 2-hour course on how to inject Botox, and they're basically learning on their patients.
That's a great point. Let's talk about your take on dose equals duration, because what if I'm a client coming in, I'm on a budget, and I want 20 units in 4 areas?
You get that sometimes where a patient comes in, they need 60 units of Botox in 3 areas, like the forehead, glabella, and crow's feet. And like, oh no. The last place I went to, I got all 3 areas for 20 units. I'm like, that's impossible. I mean, and I'm like, and and it lasted like 6 months to a year. I'm like, I mean, I don't know what's going on, but clearly people are being told either they don't need that many units, they have a distorted idea of what actually looks good after they get their service performed, and they don't realize sometimes the difference in quality of service. I mean, a lot of patients return to me, and I'm sure to your place, because they're getting consistent, reliable results. They're not jumping from Groupon to Groupon to Groupon. And that's the kind of the state of the industry, where a lot of patients are leaving practices because they want to go find someplace cheaper, or whatever injector they're used to seeing at whatever place they're going to is constantly changing.
Let's hit on Groupon for a second. Every company in the country, no matter what industry, what vertical you may be in, we want a promotion, we want a deal, right? I'm a big believer in, if you are going to acquire a new client, you have to create some sort of value around the service, right? And for that reason, at Refresh, we allow one Groupon, only one per new client, so they can experience what it is supposed to be like. And there are clinics out there that are just Groupon after Groupon after Groupon after Groupon, and it's unsustainable from a business perspective. It's a loss leader. There is no money being made on a Groupon. The overall objective is to show the patient what the experience is supposed to be like, and hopefully get them hooked on what it feels like to look better and feel better about yourself. What's your take on acquiring that patient and allowing them to retain your services, how you retain them, and the overall scope of treating them like a patient and not a Groupon shopper?
I think when you have someone come in off a Groupon or any kind of advertising campaign, because at the end of the day, Groupon's just a form of advertising, and you bring them in, but it takes more than just giving them a service that produces a great result. Because I've had high rates of attrition when I first started out, where you give a patient a service like Botox or a filler, and they have a great experience, they get great results, but they still go somewhere else 6 months later. And it's usually, because a friend told them to go somewhere, or they found a deal somewhere. And so I think that the main thing is to keep in contact with that patient, to incentivize that patient to return enough times so that they're comfortable with you as a provider. And I think that's where a lot of medical spas don't realize the importance of that continuity of treatment, to establish a significant relationship with the patient so they keep coming back and they stay your patient for years.
Yeah, and based off of continuing to keep this patient, there's a crazy statistic out there that 21% of private healthcare or private equity backed firms are going bankrupt. Why are you thinking that you have all this money backing your corporation, or some big venture capital private equity firm comes into the industry because they start to see the margins? Why are these companies with that type of resource going out? Is it because of the Groupon shoppers, because of the advertisement campaigns? What is it?
I think from a business standpoint, they don't know how to manage it. And you would know better than most that it's a pretty complex business to manage properly, because there's a lot of different variables, not just the marketing, not just the patient contact, the retention, the CRM that provides all these incentives to remain a patient, the quality of experience once they get to your clinic, once they leave, post-care instructions, etc., provider follow-up. I mean, there's a lot of elements to it. It's not like getting a haircut. I mean, in some respects, any service industry requires all those attributes, but I think it's because of the competitive nature of South Florida, it's very, very difficult.
Now, let's pivot more towards this patient perspective. If I'm a patient I've never had wellness, never had aesthetic laser services in the past, what do I need to look out for when going to a clinic? Because, as you previously mentioned, we're in Florida, which is arguably the biggest industry for aesthetics and wellness, less some of the major cities out there. So what do I need to look out for?
Well, it's not just the biggest, but just like a lot of things with Florida, it's the shadiest. And one, there's a lot of unlicensed injectors, practitioners, especially down as you get further south, Miami area. There's a lot of people doing injectables there that have no business. They're licensed in other countries that have no licensure here or just have basically no experience whatsoever. There's no physician oversight for a lot of these practices. They're required to have a medical director, but...
Talk about that. Talk about physician oversight for to satisfy statute requirements if you are not primarily aesthetic, right? So if you're a hormone clinic and then you provide Botox or aesthetic services on the back burner, why, and they're hiring doctors out there that are, ER doctors or cardiovascular related. Why do you think that, is acceptable, or not acceptable?
They're not just ER doctors or anesthesiologists. They're retired, basically. And so they haven't been practicing medicine for a while. They still have their medical licenses, but they just want to do something where they earn a paycheck for doing nothing. So there's a lot of medical directors out there that are never on site of the place that they're assigned to, that basically have little to no knowledge of any of the services that are being performed there, and are just there to fulfill a legal obligation for the place to have a medical director.
And don't you think that's a problem?
It's a huge problem. And I honestly don't think...
One of the biggest. Why
I really don't think a lot of these places do have medical directors anyways. And if they do have medical directors, they have a medical director that doesn't know anything about the services they provide and is just stamping their name on the window.
Do you think they're aware of the statutes and operating within the gray, or unaware of the statutes and they think they're compliant?
Both. I think most of them are compliant, maybe 20 to 30%. And there's some that are outright completely negligent on every aspect of compliance. But the ones that are and even some of the bigger chains, like for example, Ideal Image. I've seen them advertise Cool Sculpting for weight loss. I mean, clearly, that's not what Cool Sculpting is for. But I mean, if they had any physician oversight or whatever their medical compliance officer is, I mean, that's a huge company. You figure they wouldn't be making stupid mistakes like that. I mean, it becomes extremely sleazy at some point, And with this wellness resurgence in the last few years, where you have a lot of clinics moving from cosmetics to wellness services. Now we're doing, obviously, weight loss with the GLP-1s has become huge in the last couple of years, and peptide therapy, testosterone replacement therapy. Now you're getting much more medical, right? Now you're dealing with medications, prescriptions, lab work. You have places like BioStation calling them biomarkers to sound like intelligent, but it's just basically a sleazy way of presenting, basic lab work. And if you throw a bunch of fancy words at patients, it makes them think they sound more credible. But at the end of the day, it's just a sales pitch. And what you really need is someone that's paying close attention to the lab works, medications, medication interactions, past medical history, and actually following the patient closely and giving them a customized treatment. Almost all of these places that do wellness, all the med spas that have become wellness centers, all the Liquid Vita lounges and IV places that have become wellness centers, have a one-size-fits-all approach, and it's it's bad. It's bad.
If you're a provider out there and you're currently practicing aesthetic or wellness medicine, and again the regulations vary from state to state. Nothing is or minimally regulated on a federal level. I would just sit back and ask yourself whether or not you have a proper relationship with your supervising physician, because at the end of the day, if something goes wrong, do you have someone that you can rely on and count on and ask questions on how to handle the proper situation? Because there are horror stories out there of patients, not just from a negligence perspective, but from an infection perspective, and not proper aligned protocols and post-care procedures.
Yeah, one, there's no protocols in place for when something does go bad, when something goes wrong, and not every time that something goes wrong is the place that provided the service at fault. It could just be they're in an unlucky circumstance, an unfortunate circumstance where a patient has an unforeseeable reaction to something. But a lot of times it's something that could be avoided, and a lot of it's due to obviously inexperienced providers, improper oversight by the medical directors, as you mentioned.
How do you get experienced? Like, if you're a provider wanting to come into the industry, what is the best way to get experience? Because it's not like doctors are handing out internships left and right within the industry. So what's your go-to recommendation from a provider who wants to get into the industry and learn about the proper way to approach wellness and aesthetic medicine?
Well, I'll tell you the way 99% of the way it's being done is to go take some half-baked course from one of these
online certifications.
Yeah, online certification providers, where actually the certification really means nothing. But let's say you get a Botox certification. You went to a 2-hour course and rent a recycled pamphlet on how to inject Botox. What you really need is a physician mentor, someone that's been doing this for years and years, has practiced on thousands of patients, and can show you the idiosyncrasies of how to inject, and how injections can vary between different patients, because every patient has subtle differences in musculature and facial muscle location, and et cetera. So there's slight, variance in anatomy from one patient to the next. So, that's really the way it should be done. If you can find a business or a medical spa that is willing to provide the training necessary, not send you to some course to get a certification and then practice on all their patients to become good over time, but instead have a mentorship with someone that's already very experienced and has a vested interest in your success.
I completely agree. And I had a funny conversation the other day. My little brother calls me and puts me on the phone with one of his dad's friends, and we were talking about hormone replacement therapy and weight loss therapy. And he brought up the fact he gets his GLP-1 medication from a telehealth clinic, and him and his wife share it, right? Mm-hmm. Which seems like one of the most common things in our industry, but it's the most negligent way to approach being supervised and properly dosed. So how do you feel about all these telehealth clinics that are popping up left and right and prescribing GLP-1 medication? I don't know how they get away with it, but what's your take on that from a patient who just wants to save $1 from a safety standpoint?
It has gotten crazy, and I don't really know how it got to. I think the pandemic accelerated all of this.
Why?
Online. Well, because everything went online. There was no in-person, treatment at that point. Either it went everything went to telehealth, and they laxed all the oversight required for telehealth visits. And then I think it never went back to the way it was before. So now, it's not just weight loss medication; it's antidepressants, it's ADHD medication. It's basically across the board, and we're not talking about telehealth internal medicine doctors that are really taking a close look at you from a telemedicine standpoint. It's an online questionnaire, and
It spits out a dose.
it spits out a prescription.
Spits out a prescription. It's unbelievable.
Yeah, and obviously they have some nurse practitioner or PA. Most of the time, there's no physician involved that signs off on the prescription according to whatever state guidelines the prescription is written in.
Do you think that physician assistant or nurse practitioner has protocols with the supervising physician before prescribing that medication?
They should, but I don't. I think whatever protocols. Well, it depends on the size of the company. Whatever protocols they have are going to be based on the questionnaire. And if they satisfy the requirements of the questionnaire, then it spits out a yes, we'll write this prescription. I mean, and the type of medication doesn't really change. Like if it's a Schedule II substance like ketamine or Adderall, I mean, there's an online website for that. And I know we're kind of getting off topic here, but it's all kind of the same. I mean, there's very little oversight now in terms of medicine. The whole industry is gone a little bit crazy.
You know, it's funny that you say that because we're sitting on the inside of the aesthetic and wellness industry, but I went for an ophthalmology visit like a couple months ago to a very big chain. My eye doctor, who I've been going to since I was a kid, he's all the way on Palm Beach Island, and it's such a drive to make it out there. So I was like, you know what, I'm just going to go into this chain. They had a same day appointment. And I go in there and, you know, it felt franchisey, but there's nothing necessarily wrong with that. And then, you know, the assistant takes me for the basic parts of the eye exam. And then I go sit in a room and someone hops on a screen virtually, which is a technician. And then there's no in-person contact with an actual ophthalmologist. And that, you know, that's in the far left, completely different vertical versus what we're talking about. But that just shows you that there's less patient care, hands-on, you know, experiences to properly, you know, dose or diagnose.
Yeah. And I mean, you told me on the way over here today, and I was kind of blown away that you've seen in the industry, and you know more about it than me because you have 3 medical spas, large medical spas, and there are places that are paying their medical directors $400 to $500 a month. Well, who the hell is going to take a responsibility like that for $400 to $500 a month? It makes absolutely no sense from a liability standpoint or any. I mean, that means right there, the doctor has absolutely zero contact with the facility he's acting as a medical director for, because they're not going to spend any time exposing themselves to any type of ongoing patient care for $400 to $500 a month. It doesn't make sense. It's basically they're just signing on a dotted line, and that's as much contact as they have with that.
And let's dive into that a little bit, because recently a reporter actually just brought it to my attention about the fact that if you treat primarily aesthetic or dermatology skin-related services, you need a board-certified plastic surgeon or a board-certified dermatologist to be supervising any sort of mid-levels. I know that's a contradicting word, but physician assistants or nurse practitioners. And then there's a bunch of subsections like within, you know, a continuous county or 25 up to 75 miles, schedule posted and everything like that. How do you feel? And, you know, I actually, let me back up here a little bit. I brought on a board certified plastic surgeon because of that statute, and our primary service is laser hair removal. But to be able to sleep at night, you don't want to operate within the gray, right? Mm-hmm. And so because of that, we brought on a board certified plastic surgeon, even though on an annual basis we treat more laser hair removal than anything else. How do you feel about how that law is written or how that regulation is written? What do you think the state is trying to do?
I mean, I think when it was written, it was well intended, that they wanted medical directors with experience in the field. to supervise these type of operations.
But
However, it makes no sense at this point.
if I'm going to Forever Young, right, for hormone replacement therapy, very well-known clinic for hormone replacement therapy, their providers also administer Botox, right?
Yeah, so this is an antiquated law. I mean, it doesn't apply to the current state. All these medical spas are branching out to provide services that far exceed any medical training of a plastic surgeon or a dermatologist. I mean, you're getting into weight loss, you're getting into hormone replacement therapies, and within the subset of that, you're doing sometimes basic medical management. If a patient has an elevation in blood pressure due to testosterone treatment, you're writing blood pressure medication. It's not, that law was not intended for the current definition of what a medical spa is. So, I mean, and clearly no one is satisfying the provisions of that statute anyways. I mean, I would say 80 to 90% of medical directors are not, of medical spas are not dermatologists or plastic surgeons. I don't think this is an enforceable law because if it ever went to any kind of litigation, it won't pass the test, the sniff test. It's just nonsense.
So what do you think needs to happen? Because there are tons of clinics out there, and for patients, MQA is a free resource to fact check what type of location you're going to, what type of provider you're going to, if a physician or practitioner's license is within good standing, if they have disciplinary action.
Yeah.
It's a great resource, and there's no charge. You can look up first names, last names, clinics, addresses, and see who actually supervises what. But what do you think from our industry, as fast as it expands, what do you think needs to happen from a state regulation standpoint?
Well, the first thing is there needs to be more auditing going on of actual, like all of the locations that are providing either whether it's IV therapy and then branching out into cosmetic injectables or weight loss, hormone replacement. They all, first of all, need to make sure there's a medical director that has some oversight of this location and is actually, there are protocols in place for whatever mid-levels are practicing there. And by mid-levels, I mean PAs or nurse practitioners that are actually providing the services. Now, ultimately, it's going to be best if it's actually a physician providing the services. But in most of these, the way this industry is being run now is a lot of these places can't afford to be paying physicians to provide the services. So they're using, and it doesn't mean there's no good mid-levels to provide these type of services, but they need adequate oversight and adequate training.
Yeah, I think it's important.
So that being said, there needs to be new requirements for medical directors.
What about medical
there
spas?
Needs to, in medical spas,
Yeah.
yeah. And there needs to be, I think, new requirements for adequate protocols.
Who regulates a medical spa? Because, when you're an electrology clinic, you're under the board of electrology. When you're a physician assistant, you go to that board.
I think the Florida Board of Medicine needs to regulate it. I mean, and whatever business licensing organization is for that county or city has to follow some kind of guidelines so that in order to get a business license to operate as a medical spa or wellness clinic, et cetera, you need to satisfy certain provisions.
What about the big companies coming into play like Galderma and Allergan and Merz Aesthetics? When you have a training from one of the companies, a company training,
Mm-hmm.
you need a physician to sign off on those trainings.
That's right.
Right? So why wouldn't those companies start to fact check the physicians who are supervising those trainings?
I mean,
they just want to turn a
because
profit?
they don't have to. I mean, they're only going to do what they have to do. And I mean, they're in the business of just selling their product. They don't, I mean, if they're not required to do anything by the state, they're not going to do it. I mean, they check the license of the doctor that signs off, but beyond that, they don't check anything. They don't check the nurse practitioner or PAs. All the medication is ordered under the medical license of the medical director, and after that, they just wash their hands of it.
And, I know we're getting off track here, but Cartessa Aesthetics, the device we just brought on, the Tetra Pro CO2, one of the best devices I've ever seen. But what I've realized as we acquire more patients for that treatment, which only nurse practitioners and physicians' assistants are administering, they have their laser techs administering, cool peel. How do you feel about that?
Well,
not under direct supervision.
It's supposed to be under direct supervision. You think
a laser tech should be doing a CO2 treatment regardless of the depth, wavelength, and settings of the treatment?
I mean, it can vary quite a bit. On very mild settings, it's a very, very safe treatment, similar to pretty much any other esthetician type treatment. But yeah, as you get to a certain depth or threshold where you have pinpoint bleeding, significant ablation of the skin, I mean, yeah, that should only be done under either a direct physician supervision or a mid-level. And even when a mid-level does it, like a nurse practitioner or a PA, there should be a physician on site.
Now, with all these treatments bouncing between state lines, how do you feel about registered nurses injecting Botox?
The same way I feel about dentists injecting Botox.
Give me your take.
I mean,
give me your take.
It doesn't make any sense. I mean, why not just have someone off the street take a course on Botox and give them a license to inject? Because none of their medical training has anything to do with injecting Botox or the complications that go on with injecting Botox or filler. So I don't know why being a nurse somehow lends itself to being a cosmetic injector, other than the fact that it might sound okay to a layperson, but I mean, in practicality, it's ridiculous.
I want you to give, speaking of patients, the adverse reactions and the risks of going to a provider who may be licensed to administer Botox, but doesn't have the proper medical insight to actually administer the treatments, not just Botox, but derma fillers with vascular inclusions and all that sort of stuff.
What's the question?
Talk to patients about the risks of going to a practitioner who may be licensed to perform aesthetic treatments.
Oh, okay.
But they don't actually acquire the proper medical knowledge.
So, I mean, most people know of a lot of the adverse side effects associated with, especially dermal filler injections, which can include stroke and blindness, but more commonly can include venous occlusion, arterial occlusion, vascular occlusion in general, even nerve damage. But, I mean, okay, let's just say the person does everything right, but they end up with a vascular occlusion. They probably don't know how to manage it. They don't know what to do in the moment. They don't know how to recognize it when it happens, and they don't know how to do the follow-up care provided for that particular problem. That's when you need physician oversight, a medical director in place that really knows how to handle an adverse event. And I'd say most of these places, if an adverse event does occur, that patient's going to end up in the ER.
And, there's services as mild as, laser hair removal, but you see all these case studies popping up left and right with improper training on an electrology license, and they're burning these patients, right? Mm-hmm. Leaving them with scars and significant burns. Why do you think that? And we hear it from a patient perspective all day. You have, you've been coming to the practice for a long time, and the providers can tell you have recent sun exposure, and so they turn you away, and it turns into this whole big thing because at the end of the day, they just want their treatment. But how do you think, as a provider, you can continue to educate patients on the risks of undergoing a laser-based service with sun exposure, antibiotics, history of cold sores, recent tanning beds, and how can you, elaborate to a provider of not just winging the treatment?
Yeah, obviously you need protocols in place. You need a hiring process which is stringent in terms of what type of experience is required. If the providers have inadequate experience, they need to be mentored for a while and followed closely until whoever is supervising them is comfortable enough to sign off on their ability as a practitioner. But let's get back to the industry in general. I mean, all these medical spas recently going out of business. I mean, it's a multifactorial thing, right? From a business standpoint, what do you think about it?
Client retention. It all comes down to client retention. If, at the end of the day, there are risks.
Well, client retention and overhead.
Yes. Well, we were obviously getting our bids. Well, we finalized the bid for the Vero Beach location, and all these general contractors, some were coming in, on the far left side, and some were on the far right side in terms of the dollar amount allocated to the project. And I was trying to wrap my head around on how some of these contractors are justifying so much and how some are able to swing it so little. And, realistically, we only have the general knowledge of someone else's industry based off the research we do. And, obviously everyone thinks they're in the medical field or any field with the AI resources we have nowadays. But, it comes down to thinking an industry is so profitable and not realizing the indirect overhead costs of, Botox might cost X amount per unit, but what about the syringes and the needles and the rent? And are you calculating FPL bills and water bills and the patient coordinator checking in and checking out that patient?
Sorry.
The EHR system, the marketing to get that patient in the door. There's so many different factors of why these practices can be going out of business. And, it could say it in the filings, but at the end of the day, we can only, speculate on what's actually going on.
From what I've seen, a lot of it has to do with aggressive acquisition of equipment, expensive equipment.
You love equipment.
Yeah,
you love to acquire everything that comes out.
I'm not going to open a brand new business and have $20,000 in overhead every month.
Yeah.
And that's probably not even including staff, but like a lot of these places, they think it's a great idea to open a medical spa. They're like, wow, everyone, I can do it. And they sign on these leases with all these lasers and expensive equipment. And it's expensive for a reason, because they go through the FDA process to get licensed for use in the United States. And there's safety and efficacy research done on this equipment. But
how do you feel about all these practices bringing in knockoff devices?
It's extremely
It's
frustrating.
Horrible. It's got to be,
another
all these
unregulated part.
These fake M-Scope Neos coming in, fake Candela Gentle Max Pros. You've got every other clinic down the street that's got knockoff devices.
And the funniest thing about it,
and they market it. And
the companies, the companies like BTL and Candela and Allergan Aesthetics, like where they have Cool Sculpting, Cool Tone, whatever. They're not going after these guys. There's plenty of clinics where it's clear they'll put their clinic logo on the machine, like somehow that makes it look more legitimate. If you see a clinic logo on a machine, that's a red flag. Yeah. And I mean, yeah, you paying $150,000 for a piece of equipment from say a certain reputable company, Or you can get a $5,000 piece of equipment from China. And a lot of these places are doing that. And they're getting away with it because nobody in the state of Florida is enforcing this.
Who would enforce it?
The
Outside
Florida Board of Medicine should enforce it. I mean, I don't,
Well, then
because they're treating patients.
what about all the non-FDA approved services that or products that they're bringing to market, you know? Countless. You've got countless
Not just non-FDA approved services and products, but
medications.
there's a lot of people using these machines that aren't qualified to use them. Like, for example, RF microneedling devices. I know hairdressers using that kind of stuff. Like, it's crazy.
Well, I mean, you could go on Amazon and buy a laser hair removal device to do at-home laser hair removal or at-home microneedling, and people don't, fully see the risk of infection.
Yeah, but that's not near the same. It's not the same intensity or the same quality of device that you're going to get. Like, okay, first of all those devices are IPL, for example, and you got to do it 1,000 times, and you get a very minimal response from it. I mean, all these skin firming devices, they're scammy. I mean, honestly, none of them work. Whether it's an at-home device to firm your skin or an at-home device to increase collagen or reduce hair, I mean, I don't think any of them really work that well, despite all the reviews. But yeah, no, I don't know why all of these places in Florida are able to operate with dangerous equipment, unlicensed providers, and no physician or medical oversight. And it's ridiculous. I mean, and there's all these sleazy people exploiting all of this lack of regulation in Florida.
You know how, like, you go into a barber shop and it's like everyone has their own chair? I feel like what they're doing with medical practices, and I see some of the bigger names doing this, is they're going into, suites where you can rent out a suite and have the treatments performed. I mean, you would think that would be a red flag right off the bat.
Oh, yeah. Yeah, I mean, it's mind-boggling. I mean, you go into, like, some of these medical office buildings, and it look like you're walking into an old doctor's office from the 1970s, and it's a pop-up med spa. I mean, and whoever, is running that place obviously is going to be shady or underfunded or unable to actually provide. It takes money to invest in opening a medical spa and having, providing the regulation.
Hundreds of thousands of dollars to actually do it the right way. As a business owner or as a provider owning your own business, all the liability falls on you. Everything, all the exposure, all the liability. At the end of the day, it's all your responsibility. So, speaking to providers and speaking to business owners, I would think you would want to have stuff wrapped up tight with everything that's going on in the industry right now.
I'm probably jumping off on a tangent here, but another thing that really bothers me about medical aesthetics in general is social media. Because they're showing before and afters that are impossible. They're showing before and afters that have clearly been photoshopped. And again, the normal consumer of this type of stuff doesn't know. They think this is real. They think these claims that either the nurse practitioners or PAs or physicians are making are true. And this goes into wellness as well, where it's actually like snake oil salesmen like crazy, where you see all these guys making profound statements about what a certain medication is going to do, like a NAD drip, or if they are on a certain peptide, or if they get a certain genetic test and they know, how well they methylate, how that is going to transform their life. I mean, they make these claims that are absolutely absurd. I get sent a video from some asshole on 10X talking about how they're doing this and that and this.
How do you feel about that? A real estate company, or that's the main line of business. I think we could all agree. Going into 10x health, what's your take?
It's I mean, it's ridiculous. Obviously, this is a VC acquisition, right?
I mean,
They're owned by a big. It's another example of just a massive for profit company getting involved in medical care and becoming massive snake oil salesmen.
Why do you think patients still choose a place like that?
Because they're good at advertising.
Yeah.
They're good at making very fancy looking, eye-catching social media posts about how one thing is going to massively transform your life and you're going to live 20 years longer. And I mean, I get sent these videos all the time. Like, oh, what do you think about this? This guy's getting stem cells and now he's 20 years younger. Or this guy's getting a IV treatment and he feels like he did 30 years ago. Or, I mean, it's crazy. It's crazy. I mean, you can't make claims like that. And I know, these providers, and half the time they look like dinosaurs. Half the time they look like they're like about to die. Yet they're offering advice on longevity and how, how healthy you can be if you do this and that and that. But in the meantime, it's like going to a morbidly obese physician for weight loss. So.
That was funny. I'm sorry, guys. Yeah, it continues to blow my mind, and you only know as much as you research, right? So if you're a patient out there looking for proper treatment, I would continue to do your own research and trust the provider that you're going to. And once you trust the provider that you're going to, then listen to their diagnosis, right? Because that's another thing. How many patients do you have go into your practice and try and tell you how to treat?
And don't pay that much credence or attention or legitimacy to these social media posts, which are just there to grab views. And typically, non-medical people are doing them, showing themselves taking a shot at their desk and hyping their medical practice. Like you said, a lot of these places now are not physician-owned or operated, and they got a bunch of bodybuilders and dipshits promoting all these wellness things, and they're making a lot of money doing it. What's the name of that one place? They're very popular.
Yeah,
and
they've got good
the
marketing.
Biggest bunch of assholes I've ever seen in my life.
They've got good marketing. You could speak on the diagnosis, but at the end of the day, they've got good marketing. The place in Tampa. It's that place in Tampa. I'm forgetting the name of it.
Yeah, it's like, oh, watch me give myself an injection. I'm sitting at my desk, and you know what? I've never felt better. I used to have, no problem. I used to be tired all the time. Get out of bed, 2 hours later, be tired. Now I'm like, I have more energy than ever. I never have to sleep. And it's like, these shucksters, I mean, does anyone really buy this bullshit? And they get hundreds of thousands of views, and they're making millions of dollars just as snake oil salesmen. It's really frustrating.
Back to the original question about a patient coming in trying to tell a provider how to treat based off of their internet research.
Yeah.
Talk to me.
All the time. They're gonna come in and they're gonna be like, do you have this? Look at this Instagram reel. And I mean, or I want these lips. This will transform this girl's lips, and they went from like these super thin lips to these voluptuous lips, and it's just like, you got to realize all the stuff on the internet has become commoditized, and it's all about getting views and grabbing attention. So they're going to make unrealistic claims. They're going to show before and afters that aren't real. I'm sure at some point there's going to be AI technology that detects fake before and afters. And especially with AI nowadays, I mean, it's going to be so good at photoshopping images that you don't even need an actual patient to produce it before and after. So, I mean, we're running into a scary area.
Yeah. Yep. Well, guys, thank you for tuning in to our first episode of Inside Out. That's where we're at right now. Giving you a broad aspect from all angles of the aesthetic and wellness industry, whether you're a provider, a patient, business owner, or someone who's looking to come into the industry. Tune back in next week for the next episode.
All right. Thank you.